Hi, this is Jeez. This is the update on April 2nd, 2020. It's a Thursday, and today I think one of the days we have really struggled to go through, but I think we held on. That's a good news that we have. I wanted to give you an update, so I have been keeping myself busy with the work. Went out for a small workout in the morning. Basically, I'm trying to do everything so that I don't get bored, I don't get stressed out by sitting at home. It has been really helping me. Sorry for touching my face once again. It has been helping me from all the way, and my roommate is also pretty happy and chilled. He is also self-isolating from all his friends. I have my other friends who are staying in another apartment, and there are a couple of apartments. They're all doing great. I keep a tab on them, talk to them daily, sometimes if possible. As far as my family in India is concerned, my dad and mom is concerned, they are staying at home, they are bored, but I think this is the only way for them to to contain the disease in India, because I think if it spreads, we have seen the effect of it in countries in Europe and in the United States. So probably it's the best idea to be self-quarantining, staying in self-isolation. That's the best we can do. The next thing is, like, my brother, sister-in-law, and kids are doing great. They're also sitting at home. So the schools of these children are sending them Chromebooks. So they can continue to engage with their teachers. And then we don't know what is the plan. I think they might have classes online too. That's one of the things that we are anticipating. So probably their education won't get a bit stopped. I mean, the education won't be halted for the time being. Yes, there are one of the other numbers that we wanted to see is the unemployment registration has gone up to 6.6 million in the United States. That's like a lot of numbers. When we talked about it last time, it was 3.3 million. I think we'll go back to the economic details later, but we'll go to the numbers first. So I'm just getting this red color back because I was having some issues with the ink used in the black color, so I started getting it back. So I'll probably go back to black once again tomorrow. So today, April 2nd, 2020, we have 1 million cases reported all around the globe. So 53,198 people have died. 212,000 people have completely recovered. That's a good news. A lot of people are recovering from the cases that we know were previously marked as sick. I think they're completely clinically cured. So I think we will see the number rising pretty much soon all across the globe. So case by case, the numbers, I think United States has as you can see, has 245,000 cases, 29,874 cases recorded today. That is the largest by far we have seen. This is both due to testing efficiency and we are trying to isolate people as soon as possible. We recognize them. Tests are fast, but not to the level that we want, but still I think they are really fast. Italy has 115,000 people who has been affected by corona. 4,668 people have been tested as positive today. One of the important news about this Italy, we can see in the later point, these numbers are going down. So Spain, 112,000 people are affected. 7,947 people are tested positive today. That number is going down slightly, but it's going down. Germany, 84,794 people are affected so far. 6,813 people were affected today, at least recognized today, tested positive today. That number is going up. We were anticipating that numbers, but Germany is a country that we have to look up to because these countries are doing excellent in their healthcare systems and managing this disease. The death rates are really, really low. We wish the number to be that way, continuing. China, 81,589 and 35 new cases added to today. There's not much change from previous day. That is one of the things that the number of cases in the United States is going up is partially due to testing. Then Italy, the main issue that is happening is that at least we hope that the R naught, the reproduction rate of the disease, is coming closer to 1. I think that's our ideal stage. Probably. So there is a interesting research that has come about by incorporating the data from 11 countries in Europe. So we are seeing for some of the data and looking at this data, we are feeling that this R naught is coming towards 1. That's the good news. We really don't know how it is going to transform tomorrow. This result was published on March 30th. So till that day, they have kept track on the numbers, and then they feel that this R naught is going towards 1, which is a good news. We will continue to monitor these things more, and we will see if what models are fitting for this data, and then what we have to learn, what we can learn in order to model the state of the issues in United States and also in UK and some other countries in Europe which are still struggling. So we'll go to the death numbers really quick. So death numbers, so Italy has the highest death toll. 13,915 people died in total. 760 people died today. That number has gone down. That's one of the good news that we are seeing from Italy. I think we have a solid reason why we should believe that these numbers are coming down. Spain, 10,348. 961 people died today. United States, 6,070 people have died in total. 968 people have died today. That number is still up. This is lesser than yesterday, but that number is still high. We will see more about this United States numbers later. France, on the other hand, 5,387, 1,355 deaths recorded today. That number, I have to clarify that thing. This number is not a death in a day. So they have consolidated the data for several weeks of deaths happened in many of the old age homes. Or retirement homes. They wanted to aggregate this data, and then they took time to tabulate everything and then put that result as together as 1,355. Later on, as we get the more data about these things in the historical data, we will make adjustments in order to accommodate these deaths for the correct dates. China, 3,318 cases. 6 deaths recorded today. So I think these numbers are very consistent from China as per the records. So we believe that these numbers are believable from their records. So many of the things, especially I have said about France is going through one of the toughest times, but I think they are recognizing all these deaths which are happening in past couple of weeks, and then they are adding it, accumulating it and adding it for the time being, and then they will adjust it, course correct it. They will adjust it for the day accordingly, which they are going to do really soon. That's one of the things that we will see in the future. One of the other things that we will talk about today is that about the R naught. I think I have already discussed that fact. Second thing is that in New York, I think things continue to get bad. One of the main issues that they are facing is the shortage of the CPAP or the ventilators. In the current rate, if we are going forward, they have 6 more days before they run out of the ventilators which they have in stock. This is what we have a dire situation. They are trying to adjust for they're trying to accommodate for the errors. They're trying to accommodate for the demand. But if you continue to burn out at this rate, 6 days will be the day in which you will have to you will be finishing up with all your ventilators that you can supply to the people. One of the important things. They are also requesting resources, including the beds, staff, and the medical appliances or utilities. Any of these things they have introduced. They have asked these companies in order to ramp up the production line if they have the ability to make any sort of material cut out from a print. So they are asking these people to contact the New York government, and the New York government is going to compensate them with a premium price on it. So that's one of the things. So many of the other laws which are also getting passed in New York is really good. I think middle class tax cut has been declared. Very, very important steps that we are seeing from from New York. They are using the ventilators. They are ad hocly they're splitting the ventilators into 2. currently, which is not approved, which is not advised, but I think it helps a lot of people at the moment. So they are trying to do splitting of this ventilators. They are using BiPAP machines, which is not as powerful as ventilators, but they are effective in this COVID disease attacking. So they are trying to get all these ventilators from all across the globe. I think we will see the effect of it in coming days. Social distancing is strictly asked. We are asked to wear masks whenever we go out and whenever we are interacting with other people. Anesthesia machines are being used for the ventilator, as a ventilator without anesthesia, of course. So they are being used. Javid Center is currently used for non-COVID patients, but at any time, if the need comes, they will convert into full COVID hospitals. These are the main updates that we have, and I have been doing some sort of calculation based on the research paper that we have come out. I think these numbers, that whatever they are doing makes a lot of sense, and we can also extrapolate some of these data for the United States. I don't want to give any numbers because I think this is my own sort of personal calculation, which might have gone through a million error, which I'm sure, but I think I don't want to do that. But to get a good understanding, so I just wanted to understand why is this 93,000 which they are saying is making sense to them. Why is this 100,000 deaths which Dr. Fauci is saying makes sense for them? So based on what data are they predicting all these numbers? How do they believe these numbers? With these models, how much people predict? How do they believe? Are these even believable numbers? Where are the people getting all this weird numbers from? So these are the basic investigation that I have been thinking of. So we have got some consolation from this paper. So I'll probably link that paper to you guys in the comment section or the in the description section. Apart from that, I think we'll hope for a pretty normal day tomorrow. There's not much of things that we can anticipate. We will watch for the news. We will see how the things pan out. How the demand for the number of people who are tested positive will increase, and how the demands will peak. So that's all for tomorrow. We will see more about it tomorrow. Thank you.